There are questions in the field of biology that experimental biologists cannot solve without algorithms and computations. They can easily generate lots of data, but they actually need computer science to be able to make sense of their data. This is actually what served the basis for starting MetaSight. MetaSight works in the field of metabolomics, which is about measuring the concentrations of small molecules. There are thousands of small molecules in circulation, and while these molecules are tightly interlinked to the health condition, only a very small fraction of these are actually being measured by standard clinical tests. But there are thousands of molecules that represent your health condition that are overlooked by these methods. The holy grail in disease diagnostics is being able to detect disease based on a simple blood test. MetaSight uses a proprietary technology that enables us to perform high throughput and cost-effective mass spectrometric analysis of serum samples in around 1 minute per sample with a cost of around $1. We've been using this technology to generate the world's largest metabolomics database with 500,000 people. We are using this large database as a means to identify novel molecular signatures that are predictive of future disease and for diagnosing existing diseases in a very early stage.
MetaSight is a revolutionary platform that takes the field of metabolomics and flips it over its head. They've been able to reduce the time and the cost of a simple metabolic test by 100-fold. Full metabolomic profiling or analysis in 1 minute and $1. That's great, right? But now, where do you get thousands and thousands of samples a day to analyze and then track over time? There's only one country in the world where you have longitudinal electronic medical records and people getting tested all the time, and that's Israel. So Israel's system is sort of the perfect complementary partner to the MetaSight technology. And that sort of magic, when these two things happened together, we were then able to create MetaSight and start running forward. When you meet an academic innovator, you're looking for a few things. You're looking for someone who's brilliant, someone who has found a practical application of his discovery, of his technology, that could really revolutionize how we practice medicine. Tomer is one of these unique unicorns, someone who's not only brilliant and has a phenomenal technology, but just a true partner for building a business.
The company was built together with Eamon from day one. Eamon was super helpful in defining the company's strategy, getting connections to top talents, both for recruiting employees and for shaping our advisory board. Eamon connected us both with other portfolio companies and with major pharma companies as a means to set up collaborations.
Before I joined MetaSight, I worked in a metabolomics division. I knew how hard it is to get samples and struggle on the samples and on the analysis. 2,000 samples and 1 minute per sample, you cannot see it anywhere. The wow moment was the first day that we got 10,000 samples, choosing 2,000 out of them, knowing that we can do that in the time frame that we discussed. Doing the analysis, getting the data, you work, you plan, you think about it for months, day and night, and then just happen, and it's amazing. We can use this huge database and explore it with unlimited number of scientific questions.
The multi-omic revolution has been around now for a few years. 90% of the players in this field work on DNA. And DNA is super important, but at the end of the day, DNA doesn't hold the secret to most diseases. It does hold the secret to most cancers, but cancer is not the only problem we have. We have cardiometabolic problems, we have musculoskeletal problems, we have neurological problems, we have mental health problems. The secret actually lies in the metabolome. Understanding the metabolomics will unlock the answers to all these diseases.
I believe that in the next several years, routine monitoring of patients will be completely revolutionized. You would go to your clinic to make a routine blood test. You'll get a very comprehensive measurement that could be used to detect a variety of diseases, either existing ones or ones for which you have high chance of developing in the near future. That's exactly what MetaSight aims to do.